Physicians are trained in the art of medicine, science, and healing. We call this the practice of medicine. But healthcare is a business. SMA's Business of Medicine podcast is designed to educate physicians on a wide range of business topics with the purpose of empowering physicians with the business knowledge they need to better enjoy the practice of medicine. This podcast is sponsored by SMA Services. SMA Services is a wholly owned subsidiary of the Southern Medical Association, founded in 1984 to address the business and financial needs of physicians.
Today, we are joined by Richard Campbell, Nancy Farron, and Peter Jamison with Veritas Medical Real Estate Advisors. Richard is the founder of Veritas. Nancy is a registered nurse who joined the team in 2018, and Peter, who entered commercial real estate in 2014, joined Veritas Medical Real Estate Advisors in 2017. In this two-part series, they will share information for physicians in training that revolves largely around building a knowledge base and an awareness as it relates to medical real estate and how it might affect the decisions residents and fellows have as they come out of their training programs. Thank you for being here, and let's begin the conversation.
Well, great. Thank you, Jennifer, and the Southern Medical Association for having us in this podcast. We're excited about doing some knowledge-based training for physicians in their residencies and fellowships who are considering going out into the world. And what we think this will be is a two-part series really focused on two elements of your decision matrix. And that's either you're going to come out of your program and go to work for somebody else. You're going to go to work for a hospital system or a larger practice in your town, or conversely, you're going to come out of your training and start your own practice, go to work from yourself. Those decisions are going to lead you down different real estate paths, and we want to do our best to make you aware of the things that you should know about and how we see that decision matrix occurring to help you through that thought process.
You just mentioned two possibilities or paths. Could you share more information about working for someone else and what effect your chosen specialty might have?
So this part of the series, part one of the series, is going down the path of that you're coming out of your residency or fellowship and you're going to work for somebody. And so a lot of that is going to start with, what is your specialty? What are you training for? You know, what path are you going down? Are you going to be employed by a health system? And so, for instance, if you're a UAB student, are you going to be employed by UAB? And if so, as Peter has said, I would probably hit stop now and move on to the next podcast, because I'm not sure how much relevance there's going to be. If you are going to work for a hospital system, your involvement with the real estate element is going to be pretty limited. And so outside of some general awareness, it's likely a non-factor in your decision-making. So, however, if you're going to work for a larger practice, part of the questions would be, are you going to be urban or rural? And maybe not necessarily rural, but are you going to be in a metro area or maybe a smaller market? Are you going to be in Birmingham, or are you going to be in Dothan or Eufaula? Those questions will change your real estate path as well. So we're going to get a little bit more into, when you're going into a smaller market, how that changes the decision matrix for real estate. We're going to get into that in part two of this series, so stay tuned on that one. So you're going to work for somebody. And ultimately, based on what you've chosen to do, whether it's OBGYN, surgery, derm, pediatrics, family practice, those are going to determine whether you are going to be highly likely on a hospital campus or maybe off a hospital campus. And we understand that this is not black and white. There are exceptions to every rule. But for the most part, if you are OB, if you are surgery, interventional cardiology, oncology, most pulmonary practices like that, you are probably going to be on a hospital campus. So you are either working for the system itself, for the hospital itself, or you're working for a larger practice who has got a presence on that campus. And that's a different set of real estate decisions as well. Off campus, good examples of that would be dermatology, plastic surgery, rheumatology, pediatrics, oral surgery, allergy. And again, we know that some of these cross over and then they can be both. But if you're going down those paths of specialties, it's a pretty good chance that you will be working for a practice who is in an off-campus location. So being aware that on and off campus are absolutely going to have different real estate structures and dynamics is an important starting point. So if we assume that you're going to be on campus, you've chosen to go work for a practice and they have their presence on campus. The first thing, and a lot of this, by the way, you should be aware of these things because as you're coming out of your program, as you're being recruited, as you're looking for a job, the awareness of things like this in your interview processes is important. It's good things to know, and it may generate some questions that you may ask. So understanding who owns the building that the practice is in, where you're going to work. Is it truly a hospital-owned building? So it's on campus and owned by the hospital. But be aware that that's not always the case. As a matter of fact, these days, that's more often not the case. Hospitals are becoming bigger and bigger fans of having third-party ownership on their campuses. So then who is it? Is it a real estate investment trust who owns the building? Is it a local developer who owns the building? And oftentimes, you may have a combination of those. You might be in professional office building 1 that's owned by the hospital, professional office building 2 that's owned by a REIT, a real estate investment trust, and professional office building 3 that's owned by a local developer. But knowing who owns it is important because there's an absolute effect on the real estate, the decisions, costs, etc. So we are assuming that if you're on campus, you're leasing space. Your practice is leasing space. So for you to come out and be a younger associate, a younger physician in that practice, it's good for you to know what is the liability. And when we say what is the liability, what we mean by that is how many years are left on the commitment? How many years are left on the lease that your practice has signed? How much square footage has the practice signed up for? Can that accommodate you as a new employee? Can it accommodate anybody else? Or are you going into a practice that has space that accommodates 4 physicians and you're the 7th? Be aware of that and ask those questions. What is the total monthly cost of occupancy? So what does it really cost for the practice to exist in that space? And so what we mean by that, what's included in the cost of occupancy is your rent and any operating expenses that go along with it, and understanding how those things, what is included in your rent and what is not, but ultimately, for the perspective of a young physician assessing the real estate liability of their future employer, the total cost of occupancy is the rent and all of the operating expenses coming up with one good annual number divided by 12. That's the monthly exposure that practice has every month to exist in that space. You need to know what it is and understand where it comes from. Do you have or will you have any personal obligation in regards to that lease liability? So coming into the practice, are you going to be asked to pay a percentage of that obligation as part of your agreement? Or are you simply being paid off of gross revenue and let's say you're allowed to keep 30% of your gross revenue, and it really doesn't matter what the lease liability is for the practice. But if you're being paid off of net revenue, it absolutely matters what the cost of occupancy is, because the lower net revenue, the lower you get paid. So the higher cost of occupancy means the lower net revenue. So being aware of how you're going to be compensated in your new position and how that is affected by your total cost of occupancy is going to be important. And then being aware within that total cost of occupancy with how does that look with the total revenue of the practice? And the example would be, is it costing the practice 5% of their gross revenue to exist in a particular space? Or is it costing 30% of their gross revenue to exist in a particular space? And we call that, is the practice running lean or are they fat? You know, if you're running lean, you're generating a good bit of revenue and your cost of occupancy is in the, you know, I'd say south of 10% range. South of 10% of gross revenue is pretty good. South of 5 and 6% is running pretty lean. Somehow, some way, those things end up, the leaner you run, it generates more cash for the practice. Somehow, some way, it probably comes back to benefit you as well, even if you might not be the immediate beneficiary of that. Knowing how that works and where they are in that percentage of gross revenue is going to be important. So, and then, of course, the biggest thing is making sure that they're not going to ask you to step in and immediately sign on to some type of lease guarantee or absorbing some type of liability, unless, of course, you're being recruited into an immediate partnership, which we don't see very often. That may be the case, but unless you're being recruited into an immediate partnership, you should be very aware that it would not be normal for you to accept any form of direct liability to that lease. So these are the types of questions that really help you assess the health of the practice. And it may be a decision maker if you've got two groups that are recruiting you, two groups that you love, everything seems to be matching up, and you find out that one of them is running at 30% cost of occupancy over their gross revenue and the other is running at 4%, you know, maybe decisions like that can kind of become a tiebreaker. So it really is good for you to figure those things out, and it will likely help you in that interview process and to prepare for your future partnership in the practice. You know, making the assumption that there is growth and that you do want a bigger future there. So
could you talk more about what you need to know or be aware of as it relates to off-campus practices?
So if we shift the conversation a little bit to more of an off-campus setting. So you're going to work for a practice that is located off-campus. I think one of your first big questions is does your prospective employer actually own their real estate as opposed to leasing? Have they gone out and built something or bought something? If that's the case, do you have an opportunity to buy in at some point? Always a good question to ask. And conversely, something that most people don't think about is, are you going to be forced to buy in at some point? We have absolutely seen that scenario, and sometimes it doesn't work the way you think it should. You're forced to buy in at a time when you might not be ready, or you're forced to buy in and absorb a part of the building debt that you may not be capable of, or maybe you and your family are not comfortable with absorbing that debt. So forced buy-ins should be watched for, can sometimes be a good thing, but just as easily be bad. It's a double-edged sword. So does the property produce, if they own their own property, does the property actually produce income? Did they do it as an income-producing investment? Or did the owner simply buy the property and they're paying down the debt every year, but it's not really generating income? The idea is that it becomes an investment in the future. Those are very big differences on a day-to-day scenario, and understanding those differences is going to be important.
What are some additional considerations to think about?
Acknowledging that ownership is not always a good thing. Sometimes it can be a whole nother line of business. It can be distracting from the medical practice, and being aware that it's okay to not make the assumption that ownership is the pinnacle and it's the next best thing and that you should absolutely do it, or that it's a great thing that your prospective employer owns their own building. You have to be aware of that double-edged sword and the potential pitfalls that come along with ownership. And debt is one of those pitfalls. Sometimes there's no debt at all on a building that a practice owns, but asking that question is going to be good data for you to have. So if they don't own their space and they're off campus, well, then they lease space. So again, taking you back through, very similar to being in an on-campus setting, if you're off campus and they're leasing space, be aware of who you're leasing from. And it goes back, it really could be the same people. It could be a REIT. It could be a local developer. It could be a completely different physician who owns a bunch of medical real estate. And so you're leasing from another physician. But being aware of who your owner is important for future negotiations, for flexibility, etc. And then what is the lease liability? Has your practice gone out and committed themselves to a 15-year lease at 20% above market or 25% of gross revenue, and they're running pretty fat? Being aware of what your lease liability is, square footage, term, how much term is left, how big of a space is it, what is it costing every month for the practice to be there, and then going back to how does that affect how you're getting paid? Whatever your compensation package is with the practice, understand how that compensation package is linked to the total cost of occupancy. So in these cases, whether you're on campus or off campus, real estate is going to also come into play when you're considering your path to partnership. So how many partners are there? The group that's hiring you, how many partners are currently there? Is it 2 or is it 22? Very different dynamics there. And at what stage are they in their practice life cycle? It is very different to be hired by 4 physicians who are all in their 60s and they're bringing you in as their succession plan, right? As opposed to you go into a 9-physician practice where 2 people are in their upper 30s or lower 40s, a couple people are in their 50s, and the remainder are in their 60s, and one is close to retirement, just turned 70, and there is a good succession plan in place. That path to partnership and where they are in their practice life cycle are things that you have to know and you have to understand. The succession plan within a practice is going to be important for how you come in and where your liabilities start getting tied into the real estate. So your succession plan in a lease scenario is going to give you an indicator of when you become liable for that lease or for that personal guarantee. In an ownership scenario, your succession plan is going to give you an indication of where you might be able to invest and when you might be able to invest or when you are forced to invest. So understanding the practice makeup of where are you in your life cycle, what's the mix of the group, who is an owner and who is not, all comes back to real estate, and you need to understand how that's all connected and to be able to ask those questions.
Are there any final points or takeaways you would like to share with our listeners?
The overall reminder that we want to impart is that for any practice, whether you are an employee on campus leasing space, whether you are an employee and future partner off campus and in an ownership scenario, real estate should always be a buoy to your practice and not an anchor. We have seen so many scenarios where real estate becomes an anchor and you have worked too hard and too long to be focused on something that is not patient-centric. So do not let bad real estate decisions, not well thought out real estate decisions bring down what could be an amazing career in medicine.
We want to thank the Veritas team again for joining us today, and we hope you will tune in to part 2 of this series, which will focus on the physician coming out of training who is starting his or her own practice.
Please consider supporting our mission by becoming an SMA member or making a tax-deductible donation. You can do this by visiting sma.org/donate.